Firstly, I'd just like to acknowledge country. So today I'm on the Wurundjeri lands, and I'd like to pay my respect to their elders, past and present. And yeah, I'd like to give you a bit of a hop, skip, and a jump through some of the work we've been doing in co-design. So this piece is a little bit on using co-design to develop principles for a cycling program. And firstly, I'd like to thank the team that I've worked with. So Rachel and I were fortunate enough to work with a really wonderful team of co-researchers and senior researchers and co-design conveners as well. And the funding is noted there. Been lucky enough to present this work recently in Bruges in Belgium at the European Academy. So divided into two papers, so using co-design, and then also did one on making the co-design project as well. So it was really fab, and just thought I'd share some photos from the day. But I'll launch into some background behind this work first. So recent systematic reviews have really shown that cycling can offer multiple different benefits for young people with disability, including building their physical activity, gross motor skills, and lower limb muscle strength. And to date, programs have traditionally focused on either training beginner skills or cycling for fitness. And programs have rarely considered what it takes to link riders to recreational riding in their own local community. And this was supported in a recent online survey that we did, where we found that providers acknowledged lots of different barriers to cycling, but they rarely followed up with riders at home or mapped out a participation plan for the community. So therefore, we sought to design a new cycling program called CycLink, which would be developed with young people with disability and their supporters through co-design. So our aim was to design the key features or principles of the cycling program. And we wanted to work directly with co-designers in Victoria. And those people would include young people with disability aged 8 to 30 years of age, parents, educators, allied health professionals, and members of cycling organisations such as coaches and advocates. We had three key objectives. We wanted to explore early experiences of learning to ride a bike or a trike. We wanted to identify the key touch points, that's the key moments of interacting with a service or a product that really defines your experience of that service. And lastly, we wanted to develop the principles as well. We use an established approach to co-design called experience-based co-design, or EBCD. And we adapted this specifically for the purposes of our study for an online environment. Essentially, the EBCD method involves two key phases, so experience gathering and co-design. So during that first phase, during the experience gathering phase, we invited participants to share their photographs through photo elicitation interviews. We then analysed the interviews using a reflexive thematic analysis and developed candidate themes through that analysis method. We then categorized the photos using three-staged photo elicitation interview method, and then eventually triangulated the two outputs together to develop a script for a digital story. During the co-design phase, we had 3 workshops with adult co-design participants, and then we had 2 children's workshops as well, where we tested some of the feasibility of the ideas that were emerging from the co-design workshops. The conveners used mixed facilitation methods such as open discussion, storyboarding, and voting to identify the elements of the cycling program. And those workshops were then synthesized to provide us with the CycLink principles. So the results then. So we had 42 expressions of interest for the cycling co-design study, and 30 people went on to provide consent and joined the project as co-designers. That included 8 young people with disability, 7 parents, and 15 providers. And our co-designers offered lived experience of different types of disability, including physical and intellectual disability, and cerebral palsy was well represented within our cohort. Our providers represented several different professionals and different fields. So we had physiotherapists, educators, cycling coaches, and others. Sorry, just move through the slides. So one of the key outputs, as I mentioned, was we really wanted to identify what it was like, the early experience of cycling. And people shared their epic ride of learning to cycle, and many of them described it as a series of highs and lows, like being on a roller coaster. And so this EPIC acronym was really helpful for us to show what made cycling easy and what made cycling a challenge. And it helped us to develop our script for our digital story. For the purposes of time today, I'll just provide you with a bit of a high-level overview of what people shared. So exploring really involved trying different bikes, learning by doing, and going new places. Participation involved cycling on different paths, and that might have been recreational or for active transport, or cycling on vacation. And really went with participation, people just wanted to find the just right challenge for them. And independence was really important for people when they were learning to cycle as well, and they wanted to have a sense of freedom in riding. And balancing safety and risk was really important from a provider's perspective on developing that independence. Lastly, connection involved engaging with others in the community. And really, connection showed us that cycling goals can often impact goals well beyond just physical kind of things. So skills in communication and socializing were also built through cycling. And lastly, then the touch points from this piece. So in the center of this slide, you'll just see the 3 stages that the co-designers identified. And so they really identified 3 different stages of learning to cycle. So those were technical, informational, and relational. So the technical stage related to getting basic skills and getting set up with a suitable bike, whereas the informational stage involved accessing resources and materials to train others and train riders. And then lastly, the relational stage involved connecting with the community through formal opportunities such as clubs or groups, or informally through a buddy rider or a trained disability support worker. The 5 touch points that our co-designers identified were that there needed to be an easier process to start out in cycling, and having a fun and safe learning environment was really important. People also wanted more credible resources and more choice on different adapted bikes and trikes and trial periods which lasted longer time. And lastly, people wanted providers and sectors to stop working in silos and to start working together. So ultimately, our co-designers agreed on 5 overarching broad principles of what the CycLink program should offer. They felt it should offer choice to try out different bikes and have group options that catered to riders with different ability levels. They wanted the cycling program to offer technical expertise in assessing people's needs, adapting assistive technology, training skills, and planning for participation. They also wanted the cycling program to consider individual needs and tailor information and assistance and learning styles to the individual. They wanted the cycling program to offer educative support on ways to train or adapt cycling, and have a suite of training materials available for riders, parents, and providers. And lastly, they wanted the cycling program to be flexible and plan for changing needs and priorities in a person's health or family life. So the conclusion then from this piece was that we had a broad project scope and objective, and then we subsequently developed quite broad principles. But this project really helped to show that cycling navigates multiple different sectors, and allied health inputs often focused on that technical stage and really needs to start to explore going into more of the informational and relational stages as well. And as you'll hear in a moment from Rachel, we've been able to use this project to help support an application for an NHMRC grant to gain some further funding and test through an RCT. So thanks for your time and patience, and I think we'll keep questions to the end.